Hi, I'll start with some good news today. India reported just above 30,500 new COVID-19 cases in the last 24 hours. That's the lowest single-day rise since July 15th. Today is also the 9th consecutive day that new infections have fallen below 50,000. But now is the part we hold our breath because any effect of Diwali and other festive gatherings will begin to show only 2 weeks from now. We also have reports of reduced testing, especially on the weekend on account of festivities. In Mumbai alone, tests dipped by 50% this weekend. Kerala and Delhi continue to report spikes. In Delhi, although the absolute number of daily infections has declined, the daily positivity rate remained at 15.3% with only 21,000 odd tests conducted on Sunday. Since Friday, Delhi has recorded more than 90 deaths per day. Just as he did during the first and second wave of infections in Delhi, Home Minister Amit Shah intervened to bring the situation under control over the weekend. What we now have is a 12-point action plan, including airlifting additional doctors and paramedical staff from the Central Armed Police Forces, making available 300 additional ICU beds, doubling the number of daily RT-PCR tests, and a house-to-house survey in the entire capital. Even as these plans are being formulated with great urgency, Delhi's health minister has said that the peak of the third wave is already behind us. Again, based on what science, we don't know. Let's move on to international updates. Yesterday, the World Health Organization recorded over 6.6 lakh new cases in one day, the highest it ever has since the pandemic erupted. Twice as many people, 13 lakh, have lost their lives since then. The Director General of the World Health Organization said, "We have a very long way to go, and no country is feeling that more right now than the United States of America. It has surpassed 1.1 crore cases in all, adding 10 lakh new cases in less than a week. All 50 states are facing increases of positive cases at the same time. In at least 43 states, these increases are at or approaching overwhelming states' hospital capacities. They are rushing to impose new restrictions. Chicago has imposed stay-at-home orders again. New York, once caught badly in the eye of the storm, is beginning to feel the incoming wave as well, and so has imposed new restrictions on bars and restaurants. Oregon is entering a 2-week social freeze with gatherings limited to 6 people, and Michigan will do roughly the same for the next 3 weeks. Feels like deja vu? But there are some differences this time around. In March, places like New York were able to recruit out-of-state healthcare workers with medical equipment for additional help. But now every state is having their own peaks and needs extra resources of all kinds, including increased demands for morgue capacity and coroners. In the absence of any national strategy to fight the pandemic, the cooperative mechanisms that state governors set up the first time around to survive are not available to them anymore because no state can afford to share. Any federal coordination is even more out of the question now, with a president and a vice president solely concerned about an election they lost and can do very little about. I'll stop here for today. My name is Pallavi Prasad. I do the news here that's worthy of your time. If you find value in this COVID-19 bulletin, and if you're seeing this on Instagram or Facebook, please share this video. If you're seeing this on YouTube, don't forget to hit the subscribe button. I'll see you soon.